Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about digestive system, endoscopy, basic coding guidelines. So those who are not subscribed my channel, please subscribe my channel, press the bell button and select all, then only you will get my future videos as notifications. Okay guys, let's start from the digestive system first, fourth series. So the code range from 4000 series to these procedures. The place of service will be office visit, outpatient, ambulatory surgery, ASA, like that. In this place of service only, endoscopy related procedures they will do. So endoscopy procedure is the minor procedures. So these procedures all they will do in the outpatient settings only. Okay. So let's start from the first guidelines. So is the surgical endoscopy always includes diagnostic endoscopy. So diagnostic endoscopy we should not report separately with the surgical endoscopy. This is the first point. Okay. Then if the procedure venous access, infusion, injection, non-invasive oximetry, anesthesia, these services are also included in the endoscopy procedure. These are the part of the procedure we should not report separately with the endoscopy. Okay, then whenever biopsy is performed and followed by the excision, dissection, removal of the biopsy in the same lesion means biopsy is considered as a part of the procedure. We should not bill separately. Okay, this is very basic coding, basic surgery guidelines I am explaining in each chapter. Then next point is if the multiple endoscopy service are performed, so most comprehensive code description service rendered shall be reported. Sometime, if the multiple services are performed and not adequately described by the single code, so at that time more than one code we can bill it with the 51 modifier. Okay. If we have combination code, we can bill only one code. If we don't have that combination code, we can bill it separately with endoscopy procedure with the 51 modifier. Okay. Then if the multiple endoscopy service are rendered, but within that endoscopy, more extensive endoscopy only we have to bill it. Less endoscopy and procedures we should not bill separately. Then next point is gastroenterological procedure include CPT code range 45753, 45757 and 910102, 91299 are frequently complementary to endoscopy procedures. Okay. Then next point is esophageal gastric washing procedures and all we should not report with the esophagoduodenoscopy procedure CPT code 43235. So these washing and all, it is integral part of the procedures. We should not report separately. Then gastric or duodenal intubation with or without aspiration CPT codes are 43753, 43754, 43756 shall not be reported when performed as a part of the upper gastrointestinal procedures. So aspirations, that intubations codes we cannot be reported. Then when performed concurrent with the upper gastrointestinal endoscopy 43755 or 43757 should be reported with 52 modifier indicating that reduced level of the service was performed. So whenever that concurrently upper gastrointestinal endoscopy is performing, that time 52 modifier we have to bill it. Okay. Then next point is if the endoscopy or enteroscopy are performed as a common standard of practice when performing in another services like another main procedures, that time this endoscopy we cannot report separately. For an example, if a small intestine endoscopy or enteroscopy is performed during the creation of enterotomy or revision of enterotomy, So that time small intestine endoscopy or endoscopy is not separately reportable. Okay, so we have to bill only creation of enterostomy or revision of enterostomy only. So that time endoscopy is a diagnostic related, so we should not report separately. So next main point is endoscopy to access the anatomical landmark or to access the extend the disease of the disease means with the another surgical procedures. That time diagnostic endoscopy we cannot bill separately. This is also basic surgery coding guidelines. So to access the surgical site for this purpose endoscopy is performing means we cannot report separately. However, endoscopy procedure for diagnostic purpose decided whether more extensive open procedure needs to be performed separately and same encounter means we can bill both code with the 58 modifier to indicate staged procedure. Okay. Next point is, if an endoscopy procedure is performed at the same patient encounter as non-endoscopy procedure to ensure the intraoperative injury or any verified any during the operation main procedure any intraoperative injury or any other injury verification means that time if endoscopy is performing we cannot bill separately with endoscopy procedure with non-endoscopy procedure. This is also basic coding guidelines. Okay, next non-endoscopy esophageal dilation procedure code is 43450 43453 fails and it's followed by endoscopy esophageal dilation procedure, that is 43213 43214 43233. So only endoscopy esophageal dilation procedures only we have to bill it. Okay, so failed procedures, as we know already, all failed procedures we cannot bill it separately. Whatever doctor is completing successfully completed by which method, that method only we have to bill finally. So like same concept, non-endoscopy esophageal dilation fails and so procedure is successfully completed by the endoscopy esophageal dilation procedures. So this time endoscopy esophageal dilation procedure only we have to bill. Okay. Next point is intubation of gastrointestinal tract. Example, percutaneous placement of G tube. So this percutaneous placement of G tube includes subsequent non-endoscopy removal of the tube. Okay. So subsequently non-endoscopy removal of services included like CPT 43247. This code is endoscopy removal of foreign body shall not be reported for non-endoscopy removal of previously placed therapeutic devices. However, if the previously placed therapeutic device must be removed endoscopically means we can bill it separately by non-endoscopy procedures. Okay, such as 43247 may be reported separately if it is endoscopically removal the device means. Next point is control of bleeding is an integral component of endoscopy procedures and is not separately reportable. For example, if the provider performs endoscopy band ligation by flexible endoscopy method or colonoscopy method to control of the bleeding means we should not bill separately with the main procedures. So this is also basic coding surgery coding guidelines. So whenever main procedure is performing, finally bleeding will be there. The doctor must do control of bleeding at the end of the procedures. So we should not bill control of the bleeding separately with that main procedure. But main procedure is completed, patient went to the home and again he is returned back to the hospital for the bleeding purpose only. To control that bleeding, doctor is performing the control of bleeding procedure. This time we can bill control of bleeding procedures with the 78 modifier. You know, right? 78 modifier is global period modifier, means complications during the postoperative period. That is 78 modifier. So this modifier we have to append to the control of bleeding CPT code. Okay, if it is during the postoperative period means. Next point is, so only more extensive endoscopy procedures may be reported for patient encounter. For example, if sigmoidoscopy is completed and physician also performs colonoscopy, so during same patient encounter, so only colonoscopy may be reported. Sigmoidoscopy we cannot report with the colonoscopy because sigmoidoscopy is a less extensive procedures than colonoscopy. So like this is a example. So if only more extensive endoscopy procedures may be reported, okay. Then, so you all know this is also surgery, basic surgery coding guidelines. If the endoscopy procedure fails and is converted into an open procedures, so only open procedures is reportable. So neither surgical endoscopy nor diagnostic endoscopy, whatever it may be. So doctor is completing which method, successfully completed by which method, that method only we have to bill finally. Okay. Next point is, if the larynx is viewed through esophagoscopy or upper gastrointestinal endoscopy during the endoscopy procedure, so laryngoscopy CPT code cannot be reported separately. However, if the medically necessary laryngoscopy is performed with separately laryngoscopy means we can bill laryngoscopy, esophagoscopy or upper gastrointestinal together with the NCCA modifier. So to code that laryngoscopy, we need proper medical necessity, then only we can bill separately. Okay. Next point is fluoroscopy procedure. 76000 code. So this fluoroscopy is all integral component of all endoscopy procedures when performed. So fluoroscopy cannot be reported separately with the endoscopy procedure. For an example, 76000 is not separately reported. CPT describes gastrointestinal endoscopy for foreign body removal like 43194, 43215, 43247, 44390, 4332, 45379. So these set of codes, fluoroscopy cannot be reported separately. Okay. Then if the endoscopy can't be advanced at least 50 centimeter beyond the pylorus, we don't have CPT code. For this procedure, we have to code esophagous duodenoscopy unlisted CPT code 4479 code only we have to bill it. Okay. So this all about this. That's all about the endoscopy basic guidelines. This is the basic, very basic. So we'll see in the if anyone have any doubt, please comment. If you like this video, please like it and please comment to reach to many people this video. Okay. Okay, in next video I'm going to share colonoscopy procedure. So colonoscopy procedure is very important procedure for CPC exams. Every time this colonoscopy they are asking. Okay. So in the next video colonoscopy I am going to post. So those who wants to clear CPC exam, please follow my channel. And I would like to say thank you for my all viewers, those who are commenting my videos, liking my videos. Okay. So just for your information, so I will post all chapter wise only, like one series, next second series, next third series. Now I'm starting fourth series. So like step by step only I can able to post it. So if anyone wants any 9 series or 8 series, please wait until I'm reaching that series. Okay. Okay guys, so if you like this video, please like and share, comment, and please don't forget to subscribe my channel guys. Thank you so much for watching my video. Thank you. Bye bye.